Hello everyone and welcome to Biohackers Lab. I'm your host Gary Cohen, and on today's episode I have Dr. Benjamin Jack. Dr. Jack is a practicing emergency medicine physician and founder of Duration Health, which is a new service that gives you access to a prescribed emergency medicine kit. Benjamin, thanks so much for coming on for an episode for today.
Hi, Gary. Thanks for having me.
Yeah, so it's going to be quite fun today speaking about your new service. I mean, we're in a unique situation in the world right now. With everyone in self-isolation, or most of the world in self-isolation with coronavirus. And you've got a brand new service that you did before all of this happened for emergency kits. So I think it's good timing to speak to you about emergency medicine. So how I introduced Duration Health here as a service that gives you access to prescribed emergency kit. What is an emergency kit? Like, what are we talking about here?
Sure. So we prescribe and ship kits of emergency medications to have on hand when regular medical care is unavailable. So those kits contain both prescription and non-prescription medications. We're unique in that we do the prescribing and shipping of medications so that you have them before you need them. So that if a situation arises where you can't get to the doctor, can't get to a pharmacy, whether you're at home or traveling, you have what you need already on hand.
So that brings me up to what you sort of touched on there. Who is this ideal for, would you say? What are some examples you can think of?
Sure. So I created the kit for myself as an emergency physician. I was trying to put together a kit of medications for my travel, also for home, and realized that there wasn't an easy way to access medications like this, even as a physician. So the initial audience was me, but it's really useful for anyone who thinks they might find themselves without access to routine medical care. When we launched the company 6 months ago, we thought that was going to be people traveling, travelers, people living in remote areas, people living in disaster areas. But now we're seeing that potentially anyone could be in a situation where they can't access routine medical care just because our health system is so strained right now.
Mm-hmm. And so bringing it onto our current situation and the straining in the healthcare situation, because isolation, what I mentioned earlier, I saw on your homepage of your website, you talk about the isolation scenario. Do you think emergency medicine kits are useful in this situation?
Absolutely. By having our kit at home, you could potentially avoid needing to visit a doctor, an urgent care, a pharmacy, and address the most common medical issues just at home where you are.
Mm-hmm. And what are some of those common medical issues then, as some examples that your medications could cover?
Sure. So there are the issues that people most commonly visit urgent care for. Infections, allergic reactions, nausea, vomiting, kind of the everyday acute medical complaints. That's what our kit focuses on.
Okay. So again, I'm just trying to think, as you said, I think it sounds like common issues that an ER doctor like yourself always has to deal with. But these are medications then that people could have access to and start treatment themselves or on themselves before having to consult a doctor maybe.
So the kit comes with medications, but it also comes with the ability to contact a doctor in our service. So when you purchase a kit, the first step is you speak to an emergency physician. We go over your medical history. We talk about what you're preparing for, why you might need to have these medications on hand. And then we prescribe and ship the kit to you after we make sure that everything in the kit's appropriate for you. Now, a situation arises where you think these medications, at that point you would reach out to us, you get the input of a doctor. So the idea is not that you're just treating yourself, it's that you have the medications on hand, we're available to help you decide whether it's appropriate for you to take them or not. Now, of course, there are people who might find themselves in an absolutely isolated situation. Say you're traveling to a remote area and you're just unable to reach us or reach any doctor. The kit also comes with a field guide that describes how to use each of the medications. So in a true emergency, you have some guidance. But the idea is not that people are treating themselves routinely. It's that they have the medications on hand if they need them, and then we help guide them.
Okay. And I'm guessing also outside of when people the isolation issue, when people do travel, but we've talked a little bit about international travel, but this is even travel within the US itself that could help people.
Absolutely. I mean, as you know, I'm sure many of your listeners have. I myself had traveled to remote areas in the U.S., climbing, national parks, hiking. So you don't have to go abroad to necessarily be far from medical care.
Yeah, and situations arise. I can think probably then you're at a campsite, you cut yourself, or you start feeling unwell, and this is again the situation where you say your kit would be useful.
Exactly.
Yeah. Okay. The question though is, when you said how it works, was that the person before they get the kit, they consult with a doctor like yourself, I guess someone else who's through the service, through telemedicine. So is that like what we're doing now, a video call? How does it work?
It is. It's a video call with a physician. So we take 15 to 30 minutes, review your medical history, and again, discuss what it is that you're preparing for and figure out what's going to go in your kit.
Okay. And in the kit itself, is it just medicines or do you get other supplies, emergency supplies?
So the core configuration of the kit is medicines plus diagnostic tools. So for example, sometimes we will prescribe antibiotics to have in the kit. Along with that, we include a thermometer, a pulse oximeter, urine test strips, so tools that could help a physician decide remotely if you are actually suffering from an infection or not, and if an antibiotic is indicated. So if you use the thermometer and have a fever, that may point to, of course, depending on the situation, may point to an indication for using one of those medications.
Mm-hmm. Yeah, and what are your thoughts then? I'm going to bring it on to the current situation with coronavirus now. So when people are deciding should they go to the hospital, to the ER, so they don't know if they do or don't have coronavirus, first of all. They just got the normal cold and flu symptoms. I'm just thinking with your diagnostic kit too, do you see any value, like how people would know, like, oh, I need to go see a physician now?
That's a great question. So first, I want to clarify that our kit does not treat coronavirus. People have asked about this, and I want to be very clear. There's nothing in the kit that could or will treat coronavirus. It will not prevent it. We simply don't know what medications may or may not work to treat this novel illness, and certainly nothing in our kit is going to help treat coronavirus. What we're treating are all of the other common medical complaints that still happen. Pneumonia, ear infections, allergic reactions, skin problems, and all of these things haven't gone away just because coronavirus is present. So to answer directly, someone decide if they're at home and think that they're having symptoms of coronavirus, whether to seek emergency medical attention. So that is a difficult question, and each person should ask their doctor for specific advice. But generally speaking, if you're having symptoms of shortness of breath or chest pain, or something more than just minor cold and flu symptoms, that's the point where you should then seek medical attention. It's an interesting question as to whether a pulse oximeter can guide someone whether they should seek medical attention or not. Again, the best thing would be to contact your primary doctor, but it is true that low oxygen levels can be a sign of a worsening course of illness in coronavirus, and that a pulse oximeter could potentially point someone or alert someone early on that might be developing.
Because I see pulse oximeters are going massively on sale. Like, so many people are buying them. It'd just be interesting as an emergency room physician practicing in this era, like, do you think, like, should people bother getting these things?
So again, each person should ask their doctor, and if you are a patient of Duration Health, we will guide you more specifically on this. So there's a difference between you coming to us and you being our patient rather than me speaking, more generally on the podcast. But to speak generally, I think it is a good idea for some people to have a pulse oximeter at home. It can be a little bit tricky. The question comes up, well, what is the cutoff of the oxygen level where you would start to worry. There are issues with people then checking their pulse oximeter all the time, and like any device, it could give falsely high or falsely low readings, and people getting worried because they check the level and it's lower than they think it's supposed to be, and they get unnecessarily worried when they're not having any symptoms. That being said, even with all of those pitfalls, I do think that it makes sense for some people to have one at home. I do, yeah.
Mm-hmm. So that actually is a good point you bring up. If I get an emergency kit, what kind of follow-up is there? So I'm in that situation, I've ordered a kit. How many times could I contact you for questions? Or is it a pay per consult thereafter? Like what's covered?
It's not a pay per consult. You can contact us as much as you would like. The people who buy our kits tend to be self-selective. They're people who already have some level of health literacy, and we don't generally, this kit is not for everyone, and some people are not eligible for the kit, and so we generally don't prescribe or provide the kit to people who don't have some kind of basic health literacy. So our patient population uses this ongoing service that tends to use it in a very responsible and limited way. So we're here if you need us. It's unlimited as far as how much you want to contact us. If somebody's calling every day, I'd probably have more of a conversation with them. But other than that, it's unlimited as far as use.
Okay. And how long does the kit last for?
The shelf life of the kit is 1 year.
Okay, so after 1 year, what happens then?
So we contact you and go through, again, the same sort of interview process as we had at the beginning, review your medical history, review your anticipated needs for the kit, and we can re-up your prescriptions at that point, assuming they're still appropriate, and send you a new kit.
Okay. And do you have the medicines yourself then, or where do these medicines come from?
No, so that's a great question. So we work with a partner pharmacy that we've collaborated with to build the kit and ship them. So Duration Health is not a pharmacy. Duration Health provides medical services. So you would talk with me, talk with one of our providers as Duration Health, and then we basically send the order to the pharmacy. The pharmacy packages it and ships it out. So it's not like I, have a box of medications here in my office. It's the pharmacy fulfilling it on our behalf.
Okay. And with telemedicine, I learned something recently in the US where each doctor was limited to their state, and then they unlocked it to is what I heard in the news, that now doctors can practice across all states. Well, that was what I thought I heard. Is that the case here?
So there are still some restrictions, and again, I'm speaking generally here. It depends on the doctor. Generally speaking, the laws in each state for prescribing medication and for establishing a medical practice, it's all regulated state by state. So the federal government gave guidance, as you saw on the news, that was encouraging states to open their borders and allow doctors to prescribe across state lines, but it's still a state-by-state decision, and not every state has gone along with that recommendation. So it is still somewhat siloed here in the U.S. as far as where doctors can practice.
And so which states, residents of which states can use your service then? Who can actually use it?
Sure. So I would say the best thing to do is to check our website. We don't serve every state right now, but our list of states is expanding. So for the most up-to-date information, it's probably best if you check our website, because I don't want to give you the list and then have it change tomorrow.
Mm-hmm. Okay. But there's a lot of states, right? It's not just one.
There are a lot of states. That's right. Yes.
Yeah. Okay, good. And then how does it, so you mentioned how this pharmacy does all of this. Does the pricing change at all, or it's pretty set with what it's going to cost? So
patients pay for the medications that they get. Every kit is custom built. There's no prefabricated kit of medications. So the price of each kit is determined by what goes in the kit. That being said, there's a price point where our kits start as far as pricing, and then it's adjusted from there depending on what each patient needs.
Okay, but it sounds like the first kit you get always has some of that diagnostic equipment
That's right.
plus
Yes.
plus it. And when you do that renewal, I'm guessing some of the diagnostic stuff, like the pulse oximeter, won't need renewing, but maybe the urinalysis strips might need renewing. If I got a renewal kit, there's only certain things that would be updated again.
That's right.
Okay, and uh, also with that does insurance cover any of this?
It does not. So it's cash credit card only. We're not accepting insurance right now.
Okay. And what with some people then they may look at this service and go, oh, is this sort of like Doomsday Preppers, this kind of group of people? Have they sort of gravitated towards your service?
So yes and no. I think of our kit as a form of insurance. It's essentially health insurance that pays in health instead of in dollars. So, most of us have health insurance where if we run into a medical issue, we get to visit a doctor at low cost or sometimes for free, rather than having to, pay a lot of money to go see a doctor. And we never know when we're going to get sick or not. So by having this kit, it's sort of the same idea. You don't know if you're going to need it or not. If you do need it, it doesn't save you money. It instead saves you time and saves you potentially, time being ill, because you have a resource already there in your hands to address a problem that comes up. So again, it's kind of like health insurance that pays in health instead of in dollars. That type of insurance, quote unquote, is appropriate for a lot of people, not just preppers, so to speak. Certainly we've gotten some interest from people who call themselves preppers and, people who are always thinking about the worst case scenario. But as we've seen, we're sort of all preppers now. We're all in this situation that some of us didn't think would happen. And so our audience and our appeal, I believe, has broadened. When we launched the company, we actually thought we'd be serving travelers mostly, because travelers are people who put themselves in a situation where they're more likely to need acute health care. They're going somewhere where they don't know what the health system is like. They're putting themselves in a situation they might not put themselves in at home. They're eating things that they otherwise wouldn't eat. They're close to people they otherwise wouldn't be near. So travelers are kind of an archetype of someone who might need acute health care. But as I alluded to at the beginning of our conversation, now potentially anybody's in that situation, because we're all in a situation now where we don't know what as far as access to health care. Sorry, that's a long-winded answer to your question, but hopefully that answers it.
No, it definitely does answer it. It's just it was funny. I watched a documentary about doomsday bunkers in January, and then all of this kicked off, and I thought, oh, these people are being looked at as crazy, and then I hear they've actually run across to their doomsday bunkers, but they'll probably have emergency kits in their bunkers now. But as you said, yeah, we're living in a different world now. So no, I think that's probably answered most of the questions. So just to recap again, the service here is probably going to be useful for people to cover a lot of the common conditions where an emergency, you're sort of going into emergency room, but the doctor's there to realize, okay, you can just take these medications and it'll probably take care of it. You don't need to be admitted. You don't need further diagnostic testing, more invasive stuff. This is how we would deal with it. And hopefully most of the time you're going to get better, right? It's like with an antibiotic or an anti-nausea pill or anti-something that's just going to let your body sort it out. But if needs be, go to the emergency room and then get further consultation and testing.
Right. As with urgent care, there's some basic medications and basic things that can be done to treat minor acute illnesses. And that's kind of the spectrum of disease that we're addressing. Certainly, as I discuss with every patient that comes through our service, there are issues that can't be treated with this kit, both minor and major. You may still need to go to a hospital. You may still need medical attention. the kit is not a fix everything type of solution, but it can address some very common conditions and could potentially save you a trip again to the doctor or pharmacy, especially if you're in a situation where you can't make a trip to the doctor or pharmacy.
Mm-hmm. And you don't do people's existing prescriptions, that you don't cover those medications.
Right. And that's a common misconception about our service. So if you have high blood pressure, you already hopefully have your high blood pressure medicine, you already have a supply, you have that at home or you're bringing that on your trip. That's not included in the med kit. What's included in the med kit are the 10, 20 medications that are commonly prescribed in an acute medical situation where you go to urgent care, you say, I have X going on with me. The physician says, well, I'm going to prescribe you this medication to address it. Those are the types of medications that are in the kit.
Okay. And do you, just for the people watching the YouTube video, do you have a kit on hand just to
I
sort
do,
of show?
yes. So here's like an example kit. And again, every kit is different because each one is custom built for each patient, but this is kind of an example of what it looks like and how it's packaged.
Okay, so it's your typical, like, I can imagine if I'm talking to just audio listeners, the orange emergency kit with the zipper, you open up and there's all the pill bottles in there, and I saw some other bits and bobs all laid out for you.
That's right.
Yeah, okay, great. So Benjamin, if anyone wants to consult or take this any further, what's the best ways to get hold of you?
Sure. So you can visit our website at durationhealth.com. You can email us at hello@durationhealth.com. And that's about it. Yeah, it's pretty easy to get started if you just visit the website.
Okay, so just get the website and get in touch. And that's the first point. Just say, hi, I'd like to find out more about the kit. And then you take them on from there.
Right. If you have any questions, absolutely email us. There's also a very extensive FAQ on our website, as well as a bunch of educational material that we wrote about the use of each of these medications, the treatment of common medications in austere environments. Our website list that you can sign up for, where we send out a weekly email that describes how to treat common complaints and how to address common complaints in an emergency situation. So if get in touch through any of those means. If you're interested and you want to go ahead and purchase a kit, you visit the website, you put in your credit card, and then you'll be invited to schedule a consultation with a physician. And by the way, once you put that payment information in and schedule a consultation with a physician, the entire payment is refundable until your kit ships. So as I've kind of been talking about this, you hear me saying that not everybody's eligible, and it depends on what's going to go in the kit, depending on who you are and what medical problems you have. That is this first step is you put in your payment information, you talk to a doctor, we figure it out with you. If for whatever reason you're not eligible or your expectations of what was going to be in the kit don't match with reality, we refund your payment, and that's it. And we do that from time to time, and that's just part of the nature of what we're doing, is that it's not right for everybody. So that we've built it with that in mind.
Okay, perfect. Well, again, thank you so much for coming on for an episode to discuss the emergency kit. And I look forward to following the company and see what you guys get up to.
Thank you. My pleasure.